KRMC now offers the TIF procedure to treat frequent heartburn, or GERD. While PPIs and H2 blocking medications work to control symptoms, they do not address the underlying cause of GERD. The TIF procedure is an effective, long-term solution for chronic acid reflux with no incisions. KRMC thoracic surgeon Adam Braze explains.
GERD, or gastroesophageal reflux disease, is acid refluxing from the stomach into the esophagus, causing numerous symptoms. Everybody has a little bit of reflux, but when it becomes a day-to-day problem that is affecting your function of life, then we would label it as GERD. Common symptoms are burning in the chest, especially after eating a meal or upon laying down, retasting your food, or sour taste in your mouth. Medications, first-line treatment would be your H2 blockers and then your PPIs, or proton pump inhibitors. Really, all of these medications are for acid suppression. So they're great for ulcer disease, but reflux we're not fixing by giving medications. We are just suppressing the symptoms. The reflux still occurs and gradually gets worse. So a newer option is called a TIF, or Transoral Incisionless Fundoplication. We are trying to do the same fundoplication that you would have from a Nissen, however doing it without incisions. You're actually doing it from the inside of the patient through a gastroscope. It's creating a partial wrap, recreating the valve, and effective anti-reflux procedure. The lower esophageal sphincter, which has also been called a valve, is not a true sphincter. We have a true sphincter at the top of our throat that opens when we swallow. The lower esophageal sphincter is actually three things. It's the hole in the diaphragm and the muscles of the diaphragm. It's the muscles of the esophagus and the stomach, and it's the location of the esophagus and the stomach. The esophagus should be in the abdomen or below the diaphragm about an inch. In patients that have reflux, that distance is gone, or you have the opposite, which is a hiatal hernia. And therefore, then that, what we call the lower esophageal sphincter, is now loose or gone. So when we're doing the procedure, we're trying to recreate the anatomic position of how things are supposed to be.
To learn more about the TIF procedure, visit azkrmc.com.